Hi, my name is Paolo Cassano, and the title of my presentation today is Transcranial Photobiomodulation for Neurodevelopmental Disorders, focus on autism spectrum disorder. I work in Mass General Hospital in Boston. First of all, I want to start by thanking AutismOne for inviting me today. It's a great honor, a great pleasure to share my experience. As we start, I'd like to highlight some disclosures. I'm the co-founder of a company in the space of light-based therapeutics. However, none of the devices of this company are presented here today. So what people think autism is, sometimes they might have a kind of a simplified view of what autism is. There's much more, and there are many aspects of autism that can be traced. So it's a complex condition. From a dimensional point of view, we can recognize that executive functions are compromised, but also sensory processing. Also, there are repetitive behaviors. Motor skills can be compromised. There's definitely perseverative thinking, social awareness can be compromised. Verbal and nonverbal communication is off oftentimes, and information processing is compromised. So in parallel to having multiple dimensions, there are also many comorbidities. So anxiety can be present, attention deficit can be present, sometimes depression can be present. There are also aspects that are quite remarkable where there are specific gifts in terms of abilities that can be noted. So this is another perspective, understanding dimensions, but also understanding potential disorders that can be comorbid, present at the same time. And when we look at the different factors that contribute to autism, there are so many. And some have been proven, some are postulated, and some are related to the environment, some are related to other risk factors. In line with that, there are, to these days, many treatments that try to tackle the different dimensions or the different comorbidities. Some of these treatments are medications, behavioral program that are focused on understanding certain behaviors and trying to teach new behaviors. And then programs that are more focused on learning, education, and also additional treatment and therapies. However, this treatment, let's take the case scenario of the medication, pharmacological treatments, are fairly monodimensional. So at most, they affect one dimension. And for instance, these medications that have been approved for the treatment of autism spectrum disorder are specifically targeting irritability. Some other medications are specifically targeting other dimensions and have not really been approved yet. Some behavioral programs are targeting cognitive function and language skills. So for instance, language, communication. And these programs are not only somewhat also monodimensional in the way they target the presentation of autism, but also are highly time-consuming. They require skilled, trained professionals, which are limitations. Similarly to the behavioral program, even educational program might target some specific dimension within the cognitive function, and same way, cognitive behavioral therapy for anxiety and depression. So the question is, can we move past treatments that are monodimensional and get to broader treatments that affect many dimensions and deal with the complexity of this disorder? And more specifically, given our interest in light-based therapies, could light affect and neuromodulate, and therefore, as an example of device-based interventions, really improve multiple dimensions of ASD? So quick introduction on light therapy. I'm talking about a specific type of light. We call it photobiomodulation. What is it? It is non-invasive. It is transcranial. And it's, of course, not a pill. It's non-pharmacological. And that has a lot of appeal in the general population. We all know that visible light can be used for treatment of mood, the bright light in this spectrum. We know that there is light in high energy that can be potentially dangerous. The light that we are proposing to use is invisible light below the visible, therefore infrared, low energy, and therefore benign. What we know about this type of light is that it penetrates the cells, it gets to the powerhouse of the cell, the mitochondria, energizes the powerhouse and the cell altogether, and has trickle-down of beneficial effects on the cells. Here's another way to show the light, the mitochondria, and the beneficial effects, which are cellular proliferation, differentiation, also antioxidant effects, among others. So why the light? Well, one thing that is interesting is that although the most of the autism spectrum disorders are not classical mitochondrial disease, and just a small portion are probable or definite mitochondrial diseases, still there is an issue of mitochondrial dysfunction, meaning that these powerhouses are not working that well. So you can imagine that it is interesting to use a treatment that specifically target energy metabolism in the cell. And as we have reviewed the mechanism of neurodevelopmental disorders, we found that this mitochondrial dysfunction has a series of unfortunate effects, which are an increase of oxidative stress in neurodevelopmental disorders, increase in inflammatory markers with activation of microglia, astrocyte activation. These are cells and brain cells, and increase in inflammatory cytokines. And the light could, in fact, decrease all of those, modulate these oxygen species that are responsible for the oxidative stress, and also decrease inflammation in many ways. So there's definitely an overlap in between the pathology that we see in autism and the effects of the light. So going from the cellular models to the animal models, what do we know? What have we found? There's been an important contribution in the literature that has looked at a mouse model of autism induced by a drug called valproic acid. And so several dimensions have been tested to see whether the light could potentially reverse some of those impairment related to abnormal development, in this case, induced by valproic acid. So first, they look at social cognitive dysfunction. And in this model, what happens is that once the autism was induced, the mouse was spending most of the time in its own quadrant, and was less likely to move to the side where there was a stranger, the quadrant where there was a stranger. However, when the mouse was treated with infrared light, you can see this flow out. The mouse is more likely to engage in social activity. And this was quantified with here normalization. You can see here from the black column for the induction of autism to this dark gray column with a laser light. There was nearly a normalization of social preference. And you see here the same aspect with more exposure to the stranger box or the yellow region in the quadrant. So definitely interesting and promising results here in the animal model. They also looked at markers of inflammation, this IBA1 and GFAP. And they look at the expression in the brain in a specific area of the hippocampus. And here you see that the marker of inflammations when autism was induced were quite pronounced. Here you see in red and magenta. However, there was a normalization of this when the treatment was given with laser light. These are pictures of the tissues. We call that histology. And here you see the graph with the normalization of the inflammatory marker. You see here as well the reduction, for instance, here of the GFAP. This is just a control here, and the columns show it. These are significant findings. They look at cognitive function broadly, not just social. And what they looked here is at the ability of the mouse to find escape. This is encircled in red was the escape. And you see that the mouse that had autism was kind of wandering aimlessly. However, the mouse that had received also infrared light was kind of getting there in a more direct way. And you can see here that the mouse was spending more time. This plot shows in red the time spent in a specific region in the proximity of the exit. So definitely there was better discrimination from a cognitive perspective of kind of better choice, and the time to escape. You see here in black was the autism mouse, and you see that despite different trials, that time was fairly long. Instead, in gray here, you see the mouse that had received the light was much quicker at escaping. Motor function, just even pure motor function, as indicated by the ability to climb this grid, was definitely improved. And here you can see it as the time being decreased. The time to climb was decreased after the light. So they were faster. And also the time to climb this rope or wire was less. So the mouse was faster after the treatment. So even motor function was improved. Repetitive behaviors here are measured by the ability to be more spontaneous. Greater spontaneity is the ability to kind of explore different areas, move around a little bit. And you can see here that as compared to the autistic mouse that was spending all its time in this branch of this maze, the mouse that had been treated with the light was also exploring other areas, able to being more spontaneous here in dark gray, significant difference from the black column, and also less rearing, although not significant. So spontaneity is good. However, sometimes the mouse, even in the safe environment, can be somewhat hyperactive. So too much motor activity is problematic, becomes aimless wandering. And we saw that here, the total distance in terms of measure of movement was decreased after the treatment with the light, as well as the crossing of a line traced in their path. So immobility was increased, which was a desirable aspect. So a lot of dimensions were in fact improved here in this treated mice. So promising, right? This single treatment could affect those many dimensions of autism in this animal model. Yet, I know you're all wondering about humans, and so we have been, and I want you to here find a little more about our experience in humans. This was the very beginning. We're here back in 2017 and 2018, and this is in this picture was Marnie Nazer. Now the proportions here are not right. This picture is a little out of proportion, so that you know. In Massachusetts, Marnie and I met at a convention. Marnie is an expert in photobiomodulation for traumatic brain injury. Our group at Mass General Hospital had focused on photobiomodulation for depression. And she reported to our group some anecdotal evidence, some clinical lore as well about the benefits of photobiomodulation in some isolated cases. These were patients of Dr. Bradstreet, and the parents have agreed to disclose information and to Marnie reporting that information to us. So this mother of two children with autism was very brave and decided, under the guidance of Dr. Bradstreet, to treat herself, her two children. One child had high-functioning autism, and she treated this child, and you see this with a laser device with a specific parameters and a schedule of treatment. And notice impressive changes with better reading fluency, the child becoming more empathic, responding better to adversity, and had herself rated the child with some scales, and so that after the treatment, the scores in the best days and the scores in the worst days were better. She also went on treating her child who had low-functioning autism, and with a similar structure of treatment, and so that urine accidents were less frequent. The child had a very good summer program experience. There was no aggression, less anxiety, less OCD. The child was more likely to dress himself, and also typing better to communicate. And again, the scores rated by the mother, both in best days and in worst days, were improved. So those are very promising results. And so at that time, we were in 2018, 2018, roughly end of 2017, beginning of 2018, we're wrapping up our depression studies here at Mass General. We had a lot of experience, and I went to speak with Dr. Joe Biederman at the autism program at Mass General. And I found a lot of interest on their part. They realized that there was a pressing need for more and really no satisfying treatment to tackle the many dimension of the disorder. So the group embraced this treatment, and it was decided to start an open pilot. And Dr. Seranoglu take on and champion this study. Eventually, this was published, and here I'm presenting the data from Dr. Seranoglu's study. It was a small sample of 10 adults with autism, high function autism spectrum disorder, who were treated for 2 sessions per week for 8 weeks. And on average, the total scores of the SRS decreased significantly, but most interestingly, the different dimension improve. Social cognition, so the ability to understand social situation, communicate in social situation, being motivated to be in social situation, being aware, generally speaking, of what's happening around in social situation improved, as well as their restrictive interests and repetitive behaviors seem to improve. So very, very encouraging. And I can tell you that Dr. Seranoglu is now conducting 2 studies on different population of autism, including children, randomized controlled trials, funded trials to replicate, extend, and more rigorously prove these findings, or list test, right? So with that, while we were conducting this study at Mass General, another study was being published towards the end of 2018 by a group led by Jerry Leisman. He's from Israel and collaborated with a group in Cuba, and they ran a study, this time in children that were treated with low-level laser. Our study was with LED type of light. They chose laser light, and also their light was red light and was differently from ours, that was infrared light, and it was more targeted than ours. So the surface of treated was more contained. They ran this time a double-blind randomized study, and they saw that this was their primary focus in low-functioning children with autism disorder, that the behavior improve drastically. You see the continuous line here is the treated group, and the dotted line is placebo. So this was their primary focus, but even other dimensions were improved. Irritability was improved, which is obviously connected to the aberrant behaviors, but also lethargy and social withdrawal was decreased, meaning that they were more social, and stereotypical behaviors were decreased. Hyperactivity was less. There's a high comorbidity of ADHD in ASD, and speech was improved with less inappropriate speech. So very, very important step in this study. Having a control group was a substantial step forward in the science. Dr. Steingold just finished a replication of these findings. So not only we've seen now a randomized control study, so a rigorous study, but now we have a replication in New York State that these findings are indeed valid and replicable. She also looked at overall a low-functioning type of autism spectrum disorder, also children. And this time, she also asked the question of, do we have a proof that brain function is affected? So can we actually also wonder about the biology, similar to what we did in the animal models, but this time in humans? So she had a sample of 30 children aged 2 to 6. They are actually younger than in Leisman's study, still following a two times per week session for 8 weeks. You'll notice that there is a pattern here, and while we didn't have any contact back then with Dr. Leisman group, we had contact with them later on. We have tried to actually organize conferences together with little success so far, because in scientific symposia, this very innovative treatments sometimes are regarded with a little skepticism, especially when there is still growing evidence and there's need for replication. But the point I'm making, we didn't have a lot of contact with Dr. Leisman group, but we did have contact with Dr. Stengel group. Dr. Stengel, back in 2018, 2019, was in fact in touch with both Dr. Marnie Nazer and myself, wondering about how to organize her trial. And we've been in touch since then. What is noticeable about her sample is that she included patients, as I said, that in a vast proportion were nonverbal, so had quite a proportion of low-functioning autism. However, there was a somewhat skewed distribution with more low-functioning in the active group of randomization. What she found was that indeed there is a benefit from the treatment with active transcranial photobiomodulation. They had a specific cap design for children that has now, in fact, received breakthrough designation by the FDA, just because of these results that her group has shown. So almost 10-point change here in the scores of the CARS-2, while the sham group had a little more than 2 points. So it's a very significant difference in improvement of autism. Also, her group and her designed specific parental interviews to look at benefits and side effects of treatment, and they found that at the endpoint, the scores of the overall benefits, including multiple dimensions here, were higher in the active group. Here, higher is better. And the side effects were not significantly greater in the active group than sham, so indicating that there is a good tolerability of the treatment in the children. As I told you at the beginning, her group wonder about can we actually see any changes at the brain level? Because of course that would be very powerful as well to understand how the treatment works. and to give more tangible evidence that changes are real. And what you notice is that the sham group, looking here at the delta waves, which are very slow brain electrical waves, the slower are the brain electrical waves, the less the brain is firing. So you can imagine, means like there's less activities, there's less going on, there's less crosstalk in between the different areas of the brain. And what she saw is that there was not really much change in the sham treated over time. The more time they spent into the trial, so as they were getting towards completion of the trial, not much change in their delta waves. However, the active treatment had a decrease of these slow waves, meaning that if you are decreasing the very slow waves, it means like you're actually increasing the faster waves. You have more activity going on. And in fact, that's exactly what happened. She showed also that the delta waves that were a little faster brain electrical waves tended to increase. I'm sorry, this is actually let me double check here this aspect here. So the delta waves tended to increase. Okay, all right. Now I'm getting it right. Apologies for that. So the delta waves were decreasing as the scores of the autism were also decreasing. So which that means is that when you have an improvement in autism, you also have an improvement into those very low brain waves. And that corresponded to an increase in the next level of waves, which were the theta waves. So those were very promising, both clinical and the biological findings. Yet there's another question to be asked here is, if you might have noticed, most of these trials are 8 weeks trials. And so what happens with these 8 weeks trials is that we don't know about the long term. These are lifelong conditions. So are this treatment tolerable in the long term? And can we see sustained benefits? And this is a question that Dr. Stefano Palanti has answered in Italy. Stefano has worked for decades, actually, with my father. So there is a long-term relationship here of collaboration, first between him and my father, who's also is a psychiatrist, and with myself. Dr. Palanti has worked on pharmacological interventions and research on those, but also in the past decades on device intervention. And it was interested in applying device neurotherapeutics to autism. And he has a big clinical practice, and with appropriate consenting has tried this intervention because of really the lack of satisfying treatment in his patient, and eventually has gone back and done a retrospective study of this clinical cohort. So these were on average 9-year-old children. And in this retrospective study, children here were treated at home with an available already market device. 5 times per week for 6 months. And what he saw is that when looking at their ability to cope with situations and be more flexible, that there was a statistically significant improvement of that, but not only at 3 months, but this was maintained at 6 months. So this was really novel data about sustained effects when treatment is sustained at home with a very feasible treatment schedule if you think that the treatment is delivered at home. He also looked at inattention, and showed that even their attention scores were improved, and surprisingly, not only they were maintained improvement, but continued to improve over time at 6 months. Parental stress was decreased, and that was also a maintained benefit. And sleep quality was improved, and the benefit was maintained over time. So very promising results, very interesting results over sustained benefit. So we talk about photobiomodulation, device intervention, their multidimensional potential in autism. And then the question here is this just autism, or could it be true, or could there be benefits also for other neurodevelopmental conditions? So what do we know so far? We know something about attention deficit hyperactivity. I already mentioned that this condition is very highly comorbid with ASD as well. And Dr. Stefan also looked at this application of photobiomodulation in attention deficit hyperactivity, and look at a case series. Once more, his clinical experience in New York State. This was the treatment modality. It was somewhat a different device. You can see there's a lot of different type of photobiomodulation. So at some point, we can go into more details about the specifics of these different treatments. So this was a super pulse laser, and he had 7 patients that had been treated, mostly adult. And he reported here their impressions. Some expressed immediate clarity and ability to focus after the very first treatment. Some others expressed feeling great right away after the first treatment, and comparing that to their stimulant benefits. Some experienced that they were able to be on top of their schedule, organize their life more accordingly to their desire, their wishes. And a mother and child in one family expressed that the mother didn't have that kind of excessive energy or anxiety around things, and also the child was less feisty and less likely to argue. So that was, of course, a very preliminary evidence, and I'll show you some similarly very preliminary evidence for Down syndrome. Piero Manno is a friend and collaborator of mine in Italy, and more specifically in Sardinia, and he was very intrigued, similarly to Dr. Seranoglu's group, by our experience in depression. And so he actually used the same device we were used in our related to study in Mass Journal for depression. He brought it to Italy and used it in his clinic with children with Down syndrome. And this is a schematic of the device applied on the side of the forehead. And what he showed was quite stunning. In fact, he asked his patient to just draw a portrait of their doctor. And this is one child, an 8-year-old girl, who drew this at baseline. And after 2 weeks of twice-a-week treatment, again, you could see that the face of her doctor, Dr. Manu, was more centered. And then all of a sudden, the arms and the hands appeared, and then this was the product after the second cycle. So definitely more fine motor skills had improved, and this was true also in another case that was asked to draw a circle, and after 4 weeks of treatment, this spiral was much better defined and more centered. But it wasn't just the motor skills, it was the language skills, it was the interpersonal aspect with less behavioral problems. And this, in these days, actually, we took some of this evidence that came from Dr. Manu's clinic, and we have actually started here in Massachusetts, in Boston, a rigorous clinical trial to test the benefit of transcranial photobiomodulation in children and adults with Down syndrome, specifically for language. Similarly to the case series of Dr. Pallanti, Dr. Manu has looked at the long-term follow-up of these patients who have continued periodic cycles of sessions. These were not at-home sessions, they were in-office sessions, and so they were just periods of a cycle of sessions. And he saw that, again, the overall cognitive function had improved, the school performance, socialization, speech flow, motor function, and also other more somatic elements seem to have improved, which was quite remarkable. Again, some preliminary evidence that these effects might be maintained over time in neurodevelopmental disorders, as long as the treatments are not completely stopped. We don't know, of course, if a treatment were stopped, if the benefits would be maintained. However, what we know from other conditions treated with photobiomodulation is that typically, in order to be maintained, the benefits of treatments need to be continued. So where do we take it from here? I'll say first that there is, I believe that you have seen it with your own eyes, there is growing evidence that this type of treatment, photobiomodulation in particular, and possibly neuromodulation, so device-based interventions in general, although I haven't reviewed and I haven't presented today the data, there is growing evidence that this intervention affects multiple dimensions. We've seen it in the preclinical models, animal models, we've seen it in clinical. All these studies have shown in humans that multiple dimension benefit of this single treatment, which is a plus, which speaks about the great opportunity here of having one treatment that affects and benefit broadly this disorder. The other aspect I want to point out is that there are many benefits from this device-based intervention, and specifically light-based interventions. So they're non-invasive, they're non-ionizing. That means that they are not producing mutations that could be dangerous. So they're non-UV, in other words. They're non-pharmacological, and that's good because we know that sometimes parents or sometimes patients really dislike the idea of taking a pill, putting something in their body. There's likelihood of continuing the treatment. We've seen in this study so that treatment is tolerated, it's well accepted, it's likely to be continued. The low risk is stressed by the fact that the Food and Drug Administration consider this treatment or this device is mostly okay to be over the counter, and so bought without prescription. Natural, this is in fact very similar to the sunlight. 30% of sunlight is near infrared light. And then wearable, as I explained to you, some of these devices were just brought home by the patient and by their family and applied in that setting. And there might be also a possibility to tweak the treatment to make it fit the needs of the individual. One thing that we don't know is long-term side effects. There are very few studies. However, the study conducted over 6 months by Dr. Palanti didn't really uncover any worrisome side effects. And again, we're all exposed to sunlight all the time. And besides the UV that are not part of this treatment, we know that that is not a problem. So to say more about the future, these wearable devices are easy to use. If they are wearable, they can be brought home and many people can use them. So there are a lot of advantages here. They can also be integrated with other digital information, whether it comes from a smartwatch or from other sensors. That can lead to more personalization, making this treatment more specific. Also could lead to real-time interventions whenever you need most of the treatment. You have it there, you can use it if you need it in that moment. You saw some patients reporting, at least for attention, immediate benefits. And this treatment can improve over time if we make it a smart treatment. Overall, what this means is that there could be in the future clinics that deliver the treatment in office, but also give the treatment to the patient to be continued at home and function with this hybrid model, some in office and some remote for this type of interventions. So these clinics have potential. If anything, the point I like to take here is that there is potential for this treatment to be widely used if demonstrated to be effective and well tolerated as it seems. I'll just put a plug here for our clinic at Mass General Hospital. We do have a clinic. These are our contact information. We conduct both the research and we conduct the clinical work. Although this clinic is not FDA approved, meaning that these devices, although safe according to the FDA, haven't yet received the indication for a specific disorder by the FDA. And this is our group at a recent Alzheimer's event. We're many more, actually. This was a little representation of our group. It takes a village, and we are conducting research in Down syndrome. Specifically, my group is in Down syndrome, in Alzheimer's disease, in depression, and bipolar disorder. And within the umbrella of the hospital, there are other groups like Dr. Serenoglu's group that are conducting research in autism and other conditions. And of course, we are collaborating. With that, I want to thank you all and reach out with any questions. These are also our social media. If you're interested in hearing more, we're very active. We think that it's a part of our mission to get the word out and spread the knowledge. Thank you.